So continuing from where we left, again, these are the MRI sequences which we discussed. Again, this is important to identify that these are the vertebral levels, and there is this usually the colors whitish because of hydration, and once they become dehydrated, they tend to change the color, just like over here. A few of them above are in normal sequence, which tend to get blackened because of dehydration. This is a particular example of disc being disc affecting the spinal roots. This again is a disc impingement at C5, C6 level. This is how it's identified that the normal spinal cord is moving down and there is impingement at different levels. Again, disc impingement showing severely affected canal. The, the role is particularly important to be identified. A CT scan is good for its identifying the hard structures in our musculoskeletal system. These are the bony structures, which are particularly important. Fractures which are not clear on X-rays, tumors which are confined with bony cortices and not complete, but are easily identified. So we don't usually get CT scan or an X-ray done when a radiculopathy is suspected. It's usually the nerves which are being seen in an MRI. So whenever an MRI is advised, make sure the reason why is being advised. There's a CT scan which shows the fracture and the fragments in different positions. Usually the hard structures for which CT scan is done. With the different sequences, the axial views showing fracture at different levels. Bone scan, another investigation which is required, is usually a radionuclide scan, which affects the bone metabolism. The places where the bone metabolism is increased tend to have a high nucleotide uptake, usually in infection tumors and in fractures where the radioactive isotopes are taken up or in a greater amount, show bright up, and in places where there is less uptake are usually low in intensity, just like here, a bony tumor. The DEXA scan, which usually involves to see the mineralization of bone mineral density. It is used to identify osteoporosis and osteopenia. This is particularly again important in spinal fractures and in back pain to identify the weakness in the bone, because of which the back pain usually occurs. And hence, DEXA scan has its importance on lower back. So that ends our section, our topic of back pain here. Thank you.